And we are live. We are live. Who is here with me? Please, if you are here with me, let me just some thumbs up. Just say that you're here so that we get started. Good evening from Nairobi. Good morning from where you're watching us from. Good afternoon. This is the Purity Afya Show, Ask the Doctor, this Thursday. So if you are here with us, please just let us know that you're here so that we appreciate you. Yes. Yes. Who is here with us? Let me just see on the comment section that you're here with us. Then we will get started. So our doctor is joining us shortly. We are so privileged to have experts who are willing to, to spend their time with us every Thursday evening right here. Okay, I'm just trying to help the doctor join. But if you're here, please let me just see some thumbs up. If you're here with us, let's see some thumbs up. We are going to discuss something really, really interesting. So many moms to be with so many questions on which is the best birth plan. Yeah, which birth plan, which is the best birth method. Is it the CS? Is it the normal delivery? Can I choose which birth plan I want and stick to it? What are some of the things that make it impossible to have a vaginal birth or a C-section? All those questions, our doctor is going to answer them live here. And if you have your own questions, please make sure you drop them on the comment section so that you do not miss, or our doctor is able to answer all of your questions. So feel free to even start sharing them now as we wait for him to join us. He's just joining us in a few moments. So for those who are not here with us last week, we started Ask the Doctor live last week, and last week was an interesting session. We were with Dr. Maureen Owiti, and we were talking about a topic that was really, really interesting for so many moms to be, yeah. We were talking about miscarriage. Why do they happen? And if you missed that, please, you can go to my YouTube channel. You can go to the Purity Afya Network and rewatch that episode. We uploaded it right there. So you can just go and watch it. Again, I want to welcome everyone to just let us know what are some of the topics that you feel we should be bringing them live right here on Ask the Doctor, live on the Purity Afya Show and on the Purity Afya Network. I will be so, so honored to bring that conversation to you. Yeah, I will be so honored. It will be my pleasure to help you with experts, answer your questions. And right here, we bring conversations and have experts within their own field. Hey, Sarah, nice to see you. Welcome. Welcome to our live. We are just waiting for Dr. Mutiso to join. To join us, he will be joining us shortly. He's actually already here. So I think it's high time that we now officially start our conversation. We are so honored to have Dr. Mutiso Stephen here with us to talk about a topic that, many women are afraid of talking about, and that's, not even afraid. Sometimes you get confused. Can I choose a birth plan? Can I say, no, I want a vaginal birth and stick to it? Can I say that, you know what, I just want the CS. We are also going to bust all the myths, all the misconceptions about any of these birth plans. So if you have all the questions, please drop them there on the comment section. We shall be doing it like we did last week. Sarah, you are here last week. We appreciate you. We appreciate your presence, and we appreciate your support. So this is the Purity Afya Show, Ask the Doctor edition, and help me welcome our guest. We don't want to waste so much time. He's already here, and he's going to take us through a very important discussion on the birth plan, vaginal birth, or the C-section, which is better for you. Okay, I bring him now on stage. Hi, Daktari. Can you hear me? Welcome, welcome, welcome to our live doc. We appreciate your presence today.
Yeah, thank you so much for having me. Yes,
Yes,
I
doc.
can hear you very well.
Wow, thank you so much. Please, can I just see some flowers as we welcome our doctor? Please just send him some flowers, because you people, you are ladies, the ladies that are here, you know how gynaes, how busy they are, especially getting them on such a time. For me to get them, I always pray for them that they don't get an emergency, because of course you just have to put your clients and your patients first. Daktari is here, and we are so honored, Doc, to have you. So let's just get started. And how we do it, we just start with the conversation. And the people that are here, the ladies, the gentlemen, please, as we keep talking, keep dropping your questions right there. Keep dropping your comments also, and I will be displaying them to Daktari. I will be asking him to answer your questions. So we do it like last week. We answer the questions as we proceed. So, Doc, let's get started. Let's get started on, in a nutshell, explaining the difference between the vaginal delivery and the cesarean section.
All right. So, good evening. So, vaginal delivery or C-section, these are modes of delivery. These are uh, different ways how babies can be born. So, if a baby is born through the natural system, then we refer it as a vaginal delivery. But in case the delivery has to be done through surgery, through operation on the abdomen, then we refer that as a cesarean section. So these are modes of delivery for the baby.
All right. So, how do you tell us, as doctors, how do you determine which is the best method for a woman? Like, what are some of the factors that you consider? Or can a woman just walk to you as her gynae and say that I want this mode of delivery, or I do not want this? What are some of the factors that you look at before you advise women on which method to go for?
So some of the considerations we make when advising women which way to go is actually whether they have risk factors. If there are no risk factors, then we normally recommend vaginal delivery because it has the least complications and it's also cheaper.
Yeah.
However, we still advise pregnant women to be open to cesarean section because everything can be well during the antenatal period. But when we get into labor, then we realize there are complications. Things may not go as planned. And for this reason, I think it's important for pregnant women to be ready, just in case there is a good reason to do
Yeah.
that.
Yeah.
But having said that, there are women we advise they go straight for cesarean section
Mm-hmm.
when we pick the risk factors early.
Mm-hmm.
Some of these categories include women who have had cesarean section before, or
Mm-hmm.
women who have had other surgeries on the uterus, for
Mm-hmm.
example, removal of fibroids. There are also cases where we find, for example, the baby is seated, okay, because ideally it's the baby's head which should come first, or we find maybe the birth passage is too small, too narrow, or
Mm-hmm.
sometimes we find the baby is too big. So here we don't advise women who have babies, estimated babies whose weight is estimated to be more than 4 kilograms to push normally. This will pose a challenge. So
Yeah.
these are some of the things we look at. Of course, there are also still many indications where we will not allow normal delivery to happen. Yes.
Okay, Doc, thank you so much for highlighting those risk factors and the fact that you're saying that sometimes the plan can be normal and then it gets to a point where it has to be CS. Now, are there some of these risk factors that can be avoided so that we proceed with the normal delivery plan?
Unfortunately, these factors cannot be avoided. There's nothing much we can do about. For example, for cesarean section, we normally say the best way is to try and avoid the first one, first cesarean section, because if this happens, then there's likelihood that
Yeah.
the repeat deliveries will be cesarean sections.
Mm-hmm.
However, most of the factors, there's nothing much we can do about it, like
Yeah.
the way the baby presents. There are issues you find the baby is completely tied
Yeah.
on the neck by the cord. There are times when you find the baby is not growing well and the blood supply meant to the
Yeah.
baby is not
Yeah.
sufficient, and we think labor can cause more stress.
Mm.
Yeah, so there are many things with it's not. I mean, we can't do much. Yes, yeah.
Yeah. And there's
Yeah.
this question I wanted to ask you, but I've seen one of our viewers, Sarah, has asked, like, there are those women that want to go for vaginal birth. I think you can see the question on the screen. There are those who want to go for V-birth even after their first CS. Yeah. Is it possible? Yes or no? And if yes, what are some of the precautions that should be taken? And if no, what do these women risk? Because there are those that, I don't know that there are those that have successfully gone, but there are those that keep on asking, can I do CS? Can I go for normal V-birth after the CS?
So that's a very important question,
Yeah.
and it keeps coming up. So I
Yeah.
think it's good I answer early enough.
Yeah.
So the risk of trying once there's a cut in the uterus, there's a risk of rupture, uterine rupture, and this is a very serious complication. It can actually lead to death of the mother and the baby. It doesn't happen to everyone, but it's important. Anyone trying to get into this to understand that such a risk can occur, and when it happens, it's catastrophic. So the question is, yes, we can do selection because some of these things have been done. We can, for example, babies who are not so heavy, babies who are less than 3.5, and they are presenting normally, and the pelvis is adequate. In some countries or some hospitals, they would consider it okay to give a trial.
Yeah.
However, when it comes to our system, health system, the way it's organized, it gives us a lot of challenges because when there's uterine rupture, you must have blood. You know, we are losing blood, so you must have adequate supply of blood. We find this a big challenge in our country. Then you need actually staff who can detect that things have gone wrong. You also need even the monitoring during labor. It has to be done with what we call CTG, continuous tracing of the fetal heart, so that when we see early changes in the fetal heart, we can actually know things are not going well. So you
Wow.
find our hospitals, most of our hospitals, they are not prepared actually to be able to detect this early enough. And if this kind of complication happens, again, yeah, we don't have enough blood, we don't have enough medical personnel who can handle
Yeah.
this kind of complications. So
Yeah.
generally, we we think going for a repeat cesarean section is much safer in our setting. I hope one
Yeah.
day we get into to a place where we can probably have all the things we need, and then we can also consider this.
Okay.
Having said that, If you have a group of women, say 100 women, you select, they meet the criteria.
Mhm.
Studies have shown it's only about 50 or 60% will make it. The rest, they'll end up getting a cesarean even after labor, after
Mm.
laboring. So I think these
Yeah,
are important. This is important question. It's important information
yeah.
for our viewers to know.
Mm.
Yes.
And Doc, before I proceed to the next question, there's someone who's saying that you just operated on their friend last week, and the friend is here, so maybe she can drop her name. We give a shout out. I don't know whether Doc you will remember them because you have a lot of patients, but we are glad she's safe and she's here. So, Doc, you mentioned something very important that when you look at our systems, it is safer to do a repeat CS if the first one was. Um, all right, there she is. Let me just put her there. I don't know whether you remember. You can remember such a name. Operated on me a week ago. Wonderful doc.
Yes, I
Thank you so
remember
much.
Sharon. I remember Sharon. Yes. Yeah.
Okay. So
Mm.
there's something, Doc, important that you mentioned that if you have the first one, then unless you avoid the first one, you said that unless you avoid the first one, then subsequent deliveries, it is important that you just do the CS. So as a woman, I'll be asking how, especially a woman who has never gone through CS, probably someone who's looking at having children in the future. Is there a way I can avoid? Because you say some of these risk factors cannot be prevented. Is there a way I can avoid the first CS? To add on that, most people say that when you exercise, you get you. It's a way of preparing yourself for the vaginal birth. Is this true?
Yeah. Yes. Yeah. Thank you for those questions. I think, as I said earlier, it's very difficult to actually prepare to avoid cesarean section, unless maybe cesarean sections which happen because of personal request. Because again, that's becoming an indication. If someone does not want to go the vaginal route because of certain reasons, then we can still allow for cesarean section.
Mm-hmm.
About exercises, yes, they're important. What exercises do is they actually increase tolerance levels, so it becomes easier for women who are in labor, because sometimes labor can take some time. Some women have it easy, others take long.
Yeah.
So that one increases endurance, but it doesn't in any way affect the cesarean section
Mm-hmm.
uh, rate.
Yeah. And in case you're just joining us now, this is Ask the Doctor, and we're talking about CS versus normal delivery, which is good for you. As always, we ask you to keep on dropping your questions right there, and we will be answering them as we continue with this conversation. So far, we have covered CS versus normal delivery. When is CS unavoidable? Unavoidable. What are some of the risk factors? That is what Dr. Mutiso was addressing. So, Doc, let's now go start with the normal delivery. Assuming that all the conditions will be perfect and there will be no risk factors, no complications, how should a woman one prepare for normal delivery? And then you can maybe answer that question with what happens, yeah, during normal delivery. What should a woman, a first-time mom, expect? I'm talking about labor pain. I'm talking about contractions. Just talk about the entire signs that you are about to give birth, so that we avoid having moms that water broke, they don't know what to do next, and before they know it, they're giving birth on the way, they're giving birth at home, they're giving birth in the car. Yes, doc.
All right. So labor is characterized by contractions, and contractions are usually painful, and these contractions are regular. In other words, in 10 minutes, you can have one, even sometimes two or three contractions. So they have to be regular. That's what we refer as labor. We have Braxton Hicks, sometimes which happen during pregnancy. This is false contractions. They are not as regular. It may happen once in a day or once in 1 hour. So those ones are Braxton. So for labor, the pain, the contractions, they have to be there. And then, of course, the other things follow.
Mhm.
So some of the other signs associated with onset of labor will include the passage of show, because the cervix is opening a bit. Sometimes it may happen when there are no contractions or when the contractions start. And then also when the water breaks. When the water breaks, whether there is pain or not, we normally advise our women to go to hospital because there's high risk of infection. There's already communication now between the uterus and the external world through the vagina. So we normally advise that if that happens, regardless of whether there are pains or not, they should seek assistance.
Yeah.
So those are usually the symptoms of labor.
And
Yes.
doc, from those symptoms that you've highlighted, do they come in a certain order, or which one, when it just like comes, is it a water breaking? Which one shows that baby can come any minute? Yeah.
So symptoms of labor, actually, there's no order.
Yeah.
Yeah. So, but we normally know it's labor when the pains are there. So the pains must be there to qualify
Yeah.
that as labor.
All right. So, doc, let's talk about now the delivery, because most women are usually scared. Some women are scared of the normal vaginal delivery because they are like, oh no, I can't stand the tears. So let's talk about the reality of giving birth using the vaginal way of method. How are the tears? Do you come back to normal? There are those questions that women ask, like, what do I do after giving birth to recover? Yeah.
Yeah. So the contractions are usually painful, but this is for a short time. Usually, most women will labor for less than 24 hours. They would have delivered. Then, vaginal delivery is associated with some complications. They don't happen to everyone, but sometimes this may happen. So during delivery, sometimes we have to enlarge a bit the passage to allow the baby to come out. We give something we call episiotomy. Sometimes, if our assessment shows that the baby can safely deliver, sometimes, and we don't give the episiotomy, sometimes the mothers can get perineal tears. And then, of course, the other things, the tears can be on the perineum. Sometimes they can be deep in the vagina. Sometimes it can be in the cervix, what we call cervical tears. So the other complications which may arise, sometimes if the baby is too big, then you find actually delivery becomes very difficult. There's not much progress. The baby cannot come down. And for this kind of cases, then we have to consider delivery by cesarean section. In places where CS is not readily available, then you find these are women who finally end up with serious complications like death of the baby, like development of obstetric fistula, which will cause leakage of urine and stool.
Yeah.
Sometimes compression of nerves, and actual other complications. Yeah, so that's why the delivery should be under a skilled birth attendant, so that when we notice things are not going well, then we switch to cesarean section. Delivery should not happen at home.
Right. Actually, Sarah is asking whether there are women who don't tear at all, and I'll add that with are there women who also don't need any assistance, like to help with the passage of the baby? Because sometimes I know you cut somehow so that the baby can come. So are there some that don't need all that?
Yes, yeah, we normally make assessment during delivery. We don't do for example, that procedure I've called episiotomy to everyone. So we normally assess the size of the head, and the passage, and then make a decision. So there are women who can deliver safely without episiotomy, and also safely without any significant tear.
Wow. Who are these women? Is it because of the size of the baby or any activities they have done to to have it smooth?
Usually it's usually about the size of the baby.
Oh, okay.
Usually large babies tend to cause more damage.
Okay,
Yes,
doc.
yeah.
And I'm a mom, so I'll also ask her, is there something that I can do to maybe not have a very large baby, maybe eating or anything, because it's usually a very painful process when your
All
baby
right,
is
yeah.
large.
We normally don't recommend fasting or generally weight loss during pregnancy. But sometimes it's important to watch what one is eating. For example, if one is eating a lot of starch, a lot of carbohydrates, they're likely to pass to the baby, and then finally you end up with a big baby. We see this quite often, for example, in mothers who have diabetes, where you find a lot of sugar. Actually, blood sugar gets to the baby. You find they tend to have very big babies. So I think it's possible to eat, but I think to be a bit considerate. Yes. So that is important.
Yeah.
It's important to minimize the carbs we take in, even in pregnancy.
Mm. Yeah. And doc,
Then during pregnancy, we should eat for one person, not for two people. The way I've heard people talk.
yeah. Okay, Doc, I'll ask you this question. There are babies that are really born underweight, and probably the mom was just eating well, those carbs, but they're still not up. Then they still don't attain the 2.5 kilograms. What is the problem? Is there something we can do? Because some moms usually say, "Me, I want a big baby," so they eat chips, they eat carbohydrates. But now there are those. Even if you eat, they'll still come underweight. So, what could be the cause for that?
So the commonest cause of underweight is problems with the placenta. The placenta is the organ which actually feeds the baby. That's where nutrients from the mother get to the baby through the placenta. So if there are problems with the placenta, then it means the baby does not feed well, and therefore the baby cannot grow,
Yeah.
regardless of how much the mother eats. So that's the commonest problem we see, placenta.
Okay. So, Doc,
Sometimes you may also have problems with the baby themselves.
yeah,
But the good thing is that once they are born, because at that point, the environment, the uterus is hostile to the baby. Once they are born, they catch up very fast.
yeah,
And in a few months, you can't actually recognize that that baby was underweight.
yeah.
Yeah.
Okay. So, Doc, as we wrap up the vaginal delivery, so that you tell us more about the CS, what are some of the tips that you can give moms who have had or who are going through normal delivery? I mean, I'm talking about recovery tips. What are some of the do's and don'ts so that they recover fast to avoid infections? Yeah.
All right. So for vaginal delivery, it's important we said exercise during pregnancy, to improve tolerance during labor. It's also important um, it's important to attend the antenatal clinics, make sure everything is well. Then it's important to have a birth plan, usually by 32, 34 weeks. Someone should be knowing exactly which facility they deliver, which doctor will assist, and how they'll get there just in case of an emergency. And then I think the mental preparation is important. We
Yeah.
normally talk about psych. Psych is very important when it comes to issues to do with labor. Then, if it's possible, they can also have a companion during labor, someone who can also help them a bit, rub the back and things like that.
Yeah.
Yeah, so that's what
Okay.
I would recommend.
Okay, Doc. Thank you so much. If you have more questions on the vaginal delivery, please just drop them on the comment section. We will be picking them. I'll be asking the doc. So right now we want to move to the CS. Also, if you have questions on the CS, please drop them there so that we answer them as the doctor continues to speak. So, Doc, most of the questions about the CS, I'm sure you already know them. How many babies can I have via CS? Because you started by mentioning that when you have the first CS, it is advisable that the subsequent ones are also CS. But then how many babies can I have via CS? I want probably 6 babies, but the first one was a CS. Is this possible?
Yes, the answer to how many babies one can have through
Yeah.
C-section is simple. We don't have a limit.
Oh,
There's a
okay.
point we used to talk about 2 C-sections.
Mm-hmm.
There's a point we used to talk about 3 C-sections, and after that we used to recommend the tubal ligation. But at the moment, there's sufficient evidence that one can have actually the desired family size.
Okay.
However, the important thing to note is, of course, as the number increases, also the complications also increase. So there is high likelihood that probably one can get a serious complication, like what we
Mm-hmm.
call placenta previa,
Mm-hmm.
placenta creta, even sometimes rupture of the uterus when um, when um, when even the woman is not in labor. So these are important considerations to look at.
Yeah.
But we don't have a limit. I think
Mm-hmm.
if a woman is ready to be followed up and deliver in a safe facility, they can have as many babies as they want.
Okay, I hope, Sarah, you are answered. How many C-sections are enough? You can have as many, but you have to be, of course, in communication with your doctor. So many people say that CS moms, CS is the easy way out. It's so easy, you just go. Let's talk about whether this is true, because especially in the African setting, there's a lot of stigma for women who go through the CS. Some don't even say, they just silently keep quiet because they'll be told that you chose the easy way out. Yes.
Yeah, so the truth is the cesarean is a mode of delivery, and I think it should be acceptable.
Yeah.
No one should be seen as less because they have delivered through cesarean section.
Mm-hmm.
So, in terms of healing, I think healing is pretty fast once the procedure is done correctly, and once there is adequate pain medication. I think the healing is fairly quick, but of course it would be nice also to get experiences of those who have gone through. But
Mm-hmm.
generally, I think sometimes it's not as bad as sometimes it's put to look. So
Mm-hmm.
C-section is still a safe mode of delivery,
Yeah.
and I think the recovery is quite quick,
Mm-hmm.
and it doesn't make anyone less. It
Mm-hmm.
doesn't affect even work. I mean, in any way.
Mm-hmm.
So a mother who has had the C-section, they can still go back to their normal work after healing has happened.
Yeah.
Yes, yeah.
Okay. So, Doc, let's talk about what women should expect during the CS, because some of us are very scared of theater. You're going to theater, so what should you do? You sleep completely? Is there that option? Because I've seen other women say that they were feeling pain. Okay, but doctors say that you are numbed. So when you're numbed, are you supposed to feel anything? And is that what women call pain? Is it real pain, or what exactly happens in the delivery room while a woman is giving birth via the C-section?
Yeah, so a bit of anxiety is normal
Mm-hmm.
for anyone going through such a procedure or going to theater. But I just want to assure women that theater is very safe. It's one of the safest places one can be. It's actually safer than getting into a matatu. So in generally in theater, we the common mode of anesthesia we use is we numb the lower part. We call it spinal. Yeah. So with that, one should not feel any pain, but they may feel things like touch or a bit of pulling, but they should not feel pain.
Mm-hmm.
So before we start the procedure, we normally test and see if it has really worked.
Mm-hmm.
We can only proceed if it has worked. If
Yes.
it has not worked, then we allow either more time, or
Mm-hmm.
we can repeat, or maybe we can go for general anesthesia. So we don't do surgery when we have not abolished pain.
Yeah.
So if someone
And
has gone through that, that was very unfortunate. It should not be like that.
mm-hmm. And Doc, I'll
Yes.
ask
So
you
generally, there's
on,
no pain, and then
yeah. Okay. So on the spinal and the general anesthesia, why do, because some women would say, I don't want to feel anything, I just want to sleep. Is there any advantage of having the spinal over the general anesthesia, like a woman just sleeping and meeting with your baby later?
yeah, there are advantages of spinal anesthesia. One of the advantages is that actually the medicine doesn't get to the baby. It's not like general anesthesia. When you use general anesthesia, the drugs also pass to the baby. So if the delivery takes some time, then the baby actually, you find the baby is flat. The baby has to be assisted again because the baby is also getting affected with the drugs.
Mm.
And then it's also, I think, cheap compared to the gases, the general anesthesia we use. We don't need to use the machine to support breathing and things like that.
Yeah.
But what I like more about spinal is the fact that the mother is just awake. You can talk things. You can discuss Kenya politics. You can
But Doc, some of us
while
don't
the
want to
surgery
feel
is
the
going on,
pulling
or she
and
can
the
listen to
pushing.
music. Mhm.
Some of
Yeah,
us are
so I
scared
think
of.
spinal has more advantages. I'm actually used to it to a point where I don't remember when we did a cesarean section at general anesthesia.
Doc, you've never had a patient who is completely scared, like you're trying to pull them and they're literally coming up with you because they're scared. I think you
Yeah,
have
I think
to.
with reassurance, counseling, I think
Mm,
finally they take it.
yeah.
Yeah, it's not as painful and as bad as sometimes
Mm.
it's put.
Yeah, Doc, I've seen conversations, especially on TikTok, women saying, "No, for me, I just want the general anesthesia." So, for these doctors who examine or who administer this, is there something wrong that they do? Because you're saying that it also affects the baby. Why do they then have to put a woman on a general anesthesia when they know the baby will be affected?
Um, I think I don't know. The most C sections are done and spinal.
Hmm.
Yeah, and if one actually requests for that, I think they should just be given.
Okay.
So spinal is preferred compared to general anesthesia.
Mm-hmm.
It's even better, especially for emergencies where the mother has not starved. Maybe they just took lunch and the next thing we are going to theater. It's much safer because we don't have those risks. So in case there's vomiting, someone is still up, is okay, they can just vomit like normal person and things like that.
Mm-hmm.
So I am really an advocate of spinal where
Yeah.
possible. Yes, yeah.
Okay. And just with the case or with the normal delivery, let's talk about how long you should wait, for instance, to get another baby after the CS. Because you said you can have as many as possible, but after the CS, can I get pregnant again after 6 months, 1 year? How long should I wait? That's number one. And you can combine that also with the recovery. What are some of the things that you advise women to do when they go back home for full recovery? Yeah.
So recovery, spacing, recommended spacing
Yeah.
for getting a baby after cesarean section is the same like just for vaginal delivery. There's no difference. We normally recommend 2 3 years, and
Mm-hmm.
basically this period is to it's not for the cesarean section. It's actually to allow the baby to breastfeed, grow. Yeah, before another baby comes in to compete.
Mm.
Otherwise, complete healing only takes 3 months. By 3 months, someone has already healed.
Okay,
completely
so
after C-sections, and they can go back to their normal chores.
okay,
Yeah,
so
so there's no difference in terms of recommendation how long can one can wait. It doesn't matter the mode of delivery.
yeah.
Yeah, so after CS for quick recovery, we normally encourage movements, walking, maybe 20-30 minutes
Yeah.
every day. That one helps a lot to even reduce the pain and to prevent complications. Yeah, and then just use of medicines. Usually by a week, you'll find one will rarely require even analgesics. They're just
Yeah.
fine.
Yeah.
And then they start doing some of the chores at home. And then usually by when we see the mothers by 2 weeks, sometimes you can't even tell whether they had C-section. So
Yeah.
they're
That's
just fine. They're just okay.
mm,
And then by 4-6 weeks, if one is comfortable, one can even start sexual relations and things like that. Yeah.
yeah. Okay, so
Yes.
Doc, as we wind up, let's answer two questions. So when you mentioned that in 3 months someone is back to normal, Sarah is asking, so you can get pregnant immediately?
Yeah. We don't want anyone to get pregnant immediately because that baby needs care.
Age, Doc. You know, sometimes like you think that
The
age is
baby
catching
needs
up with us.
care. That baby needs love. That baby needs milk, breastfeeding for at least 3 years. So the
Yeah.
interval is good. We need
Mm-hmm.
at least birth interval for 3 years, and it has been shown to improve the well-being of the children.
Mm-hmm.
I think it's very stressful to get a baby after the other. They are both competing for the same milk, and I think it becomes difficult. Maybe some may be forced to discontinue breastfeeding
Yeah.
the older one. So we want to avoid those kind of things. That's why we are talking about that recommendation of 3 years.
Mm. Sometimes
Yes, yeah.
it's Doc,
However,
it can happen accidentally.
if it does happen accidentally, uh, then we have to carry on with the pregnancy,
Yeah.
and we have to carry on with breastfeeding till the end
Oh,
because we don't
so
want to
a baby can
disadvantage
breastfeed while
the
you're
baby.
pregnant.
Yes, we normally recommend we continue because we don't want to disadvantage the baby,
Mm.
and we don't also, I mean, and then we have also found out generally it's not harmful. It doesn't affect the baby, it doesn't affect the pregnancy.
Mm-hmm. Okay, so the last question is how
Yes,
long
yeah.
is delivery via CS? Like how much time will someone take in theater?
So usually for straightforward cases, C-section delivery takes about 1 hour. However, it's important to note that the other processes which take place, like taking the patient to theater, waiting for the theater to be ready. Then from there, we get to theater, then we prepare. Then after the C-section, we have to monitor the patient for some minutes in theater. So
Yeah.
overall, it takes about 2 hours. I just
Mm.
want to mention this so that sometimes if you have a patient in theater, you don't get so worried.
Mm.
Why the doctor said only 1 hour and we are not out. But the actual operation takes 1 hour.
Yeah. Doc, this is my question, not from the viewers. I'm
Yes.
also a viewer. Are there instances where the operation is not successful, like you just started well and then things go wrong? Do we have such cases? And also cases of, these are fears that I've seen from women, like especially if you're forced to general anesthesia and then you'll not wake up, or your baby will, when maybe they are being handled while they're being taken, and you maybe they could be handled wrongly and they end up with deformities. Just address those fears.
Yeah, I think the way I say it from the beginning is that theater is safe. The
Mm,
anesthesia is also safe as long as you have competent people who know when there's an issue and how to correct it.
yeah,
I think that's the most important thing.
yeah.
So, of course, mothers who go through general anesthesia, there's that worry, but generally, if we know how to make them sleep, we also know how to
Make them
discontinue the
wake up.
sleep, stop the sleep. Right? Yeah, we call it
Yeah.
reversal. So we have
Yes.
drugs which we do for that. Yeah. So
Mm-hmm.
it's an area which is well known, and this has been used for so long. And
Yeah.
you can imagine the number of surgeries done all the time.
Yeah.
So this is very unlikely to happen.
Mm-hmm.
And then luckily, usually our mothers, they're not so sick. They're not usually very sick. They're just normal. It's only that they are pregnant, isn't it?
Mm-hmm.
Yeah, so you find even the complication rates from anesthesia, they are much lower.
Yeah.
So I think there should be no fear. Also, we have systems to take care of the baby.
Mm-hmm.
Usually, when you're under spinal, you are able to see your baby. You can
Mm-hmm.
tell whether it's a boy, it's a girl, there and there, and and then the labeling is done. But we also do the same for those who are under general anesthesia.
Yeah.
Yeah. So yeah. So yeah. So if it's about some of these stories we hear about, I think they don't happen in most serious institutions.
Mm-hmm.
Yes,
Okay.
yeah. And
So,
then imagine it's a team. The doctor is not alone. There's
yeah.
a pediatrician. There are nurses. I mean, it's a
Mm.
whole system. So
Yeah.
sometimes to have all these people agree to, for example, exchange or sell the baby, I think it's a bit
Mm.
yeah, it's far-fetched.
Yeah.
I'm not saying it can't happen, but it's far-fetched.
Yeah. So, Doc, delivery is one of the scariest thing. When you're pregnant, like you always think about the ninth month and you're so scared. Sometimes if you are, you trust in God, you really pray and tell God, save me. Like, as women, you always feel like you might die because there are so many cases of women who die during delivery. So, someone is asking, what is this thing that women get in kind of a shock and die instantly during delivery? Like, yeah, maybe you can answer that because there are so many deaths, maternal deaths. There are so many. I know the postpartum hemorrhage is the leading cause. So you can address the issue of women dying during delivery. What are the possible causes and how could these causes be prevented? And then she actually, on that question, she's saying that she's adding that like amniotic fluid has something to play. I'm not sure, but that is her question. Like women get in shock and die instantly.
Okay, thank you for that question. Yeah, so sometimes um, in unfortunate events, we get maternal deaths, and sometimes this is so fast that maybe sometimes we don't have enough time to do much, like what Sarah has listed there
Yeah.
about amniotic fluid.
Mm.
So sometimes that fluid can actually get into the blood vessels,
Mm.
and if it gets to the lungs, then it becomes a serious matter. That's something we call it amniotic fluid embolism. It's something which can actually kill a woman very fast.
Mhm.
And then you have mentioned about bleeding, postpartum hemorrhage.
So, Doc, maybe to
Yeah,
stay on the
so
amniotic
so
fluid, what causes that? Is it mishandling or how does it get to the lungs?
we don't know what causes that, but what we know is that the mother is connected to the baby through the
Yeah,
placenta.
yeah,
So there are vessels from the mother's side also in the placenta
yeah,
and in the uterus. So sometimes this can happen. So we don't know the trigger, but it's something which can happen.
yeah. Okay.
And then, of course, the postpartum hemorrhage, PPH, bleeding.
Yeah,
This is the commonest reason why we lose our mothers in our country. Then we have other complications like eclampsia, high blood pressure in pregnancy.
yeah.
Yeah, this can also cause problems problems, and then infections. It's just good to mention all of them.
Mm-hmm.
Thank you.
Okay. Okay, Doc. I think it's a good time to wrap it up the show, but not before leaving us as women with a few tips. Women who are pregnant, women who are looking forward to getting pregnant, just a few tips on general wellness as we prepare for delivery. Yes.
Okay, I think we talked about nutrition. Good feeding is important, but
Mm-hmm.
of course in moderation. We need to eat for one, not for two.
Yeah.
But this has to be balanced diet. I think I've seen cravings, which sometimes they're not healthy. I think these are some of the habits one should try and
Yeah.
stop.
Yeah.
Cravings for especially sweet things,
Mm-hmm.
chips, cakes, soda. All these, I mean, they're not very good for the body.
Mm-hmm.
Then we need to attend clinics. Actually, the best time to attend clinic is even before conception. We call it pre-conception clinic. Just
Yeah.
make sure everything is all right, and then from there one can go and conceive.
Yeah.
And then during the clinic, there will be lessons and a delivery plan. And then also during the pregnancy, said exercises help a lot.
Mm-hmm.
Living an active life. Yeah. Then just in case there's something not right, it's always good to actually consult your healthcare provider.
Yeah.
Some of the things may need quick attention, what we call
Mm.
danger signs.
Yeah.
Yes, yeah. And then uh, those advise that they can have no more delivery. I think they
Mm-hmm.
should be always ready
Yeah.
for change of plan just in case there is need for
Yeah.
it. Yes,
Okay.
yeah.
I think that's a good way to end the live, that you should always be ready. Don't be rigid that have been working out, have been walking, and then you're forcing the normal delivery. It could affect you or the baby altogether. Thank you so much, Dr. Stephen Mutiso, for taking your time to really come and talk to us on, as women, as dads, as brothers, on this really important topic on normal vaginal delivery and CS. So, Doc, before we end the show, maybe you can share with us how we can get in touch with you. There are those who want consultation, there are those who need help and further discussion after this live. Maybe you can share your contact with us, Doc.
Thank you so much for having me.
Yeah.
Okay.
Doc, how can we get in touch with you?
Oh, okay. Yes, I practice. My clinic is at KNH Doctors Plaza, Kenyatta National Hospital Doctors Plaza. I'm in room
Mhm.
27. I also work
Yeah.
for Kenyatta National Hospital as a
Yeah.
consultant.
Okay, room 27, right? KNH. So you can go there and ask for Dr. Mutiso. Thank you, Doc, for your time. And thank you also all for coming and for watching and for being part of this conversation. Doc, I think I will excuse you now to leave us. Thank you so much, Doc, for your time. We really, really highly appreciate. And we will call you again and again to come and talk to us
Yeah,
when you have
thank you so much. Okay, bye.
Okay. All right. Bye, Doc. So thank you all for watching. That brings us to the end of our conversation this night. It is night in Nairobi, and we are grateful. Please feel free to suggest to us, send us DMs on our socials on what you feel we should talk about next. I have done a series with Dr. Mutiso on the vaginal delivery and the CS vaginal delivery episode dropped today at 3 p.m. You can go there and watch it from the comfort of your home or when you have time. And then next week, we'll also be talking in details about the C-section. So don't forget to subscribe. Otherwise, I wish you a lovely night, a lovely day, a lovely afternoon, depending on where you're watching or you are joining us from. I am Purity Musenzuki. Bye-bye for now.